So the first one is I've been advocating that we should shift our US quality measures strategy from what it is now to a process-oriented focus, forcing clinicians to enter data in the EHR that proves they are following clinical process, which are proxies for outcomes. I would argue that we should shift to a quality measure strategy that is focused on the elimination of low value care, measuring what clinicians didn't do, which is the absence of data and does not require data entry. Makes sense. There's $300 billion per year wasted in LVC, and shifting our focus to that also saves clinical data entry burden. This is a passion of yours. You've talked about this a fair number of times. What was the response to that post? What are you really trying to communicate? What's the core of this?
Well, our quality measure strategy in the US isn't working. Even some of the early pioneers who advocated measurement of quality, like Don Berwick and Brent James, are clearly saying it's not working. It's not changing the cost quality curve, right? So for heaven's sakes, if our quality measure strategy is not working, and there's plenty of evidence that all this data entry burden that we put on clinicians to prove that they're practicing according to those quality measures is burning them out, why don't we pause the train? Right? Let's pause the train and take another look at this, right? And there's that body of evidence. Well, then there's been this body of evidence around low value care that's been around for at least a decade, probably 15 or 20 years, that if we stop doing just a handful of unnecessary things in healthcare, meds, orders, labs, we save all sorts of money, we reduce patient harm and inconvenience, and reduce the clinician data entry burden. And this is, I think, something that people don't quite grasp. It's the absence of data. It's the absence of an order for preoperative labs. It's the absence of an order for opioids for back pain that proves that you're not practicing low value care. So it's actually the absence of data entry. So when I made that post, there were a couple of people who said, well, how do you prove something that didn't happen, right? Well, the proof is in the absence of data, whereas our current quality measures is all about documenting, proving in some way, justifying in some way that what you're doing is practicing according to the quality measure strategy we have in the country now. Low value care is the opposite of that. It's the absence of data, it's the absence of data entry.